Hi everyone. Now today's topic is a small one which we'll be talking about. It's more of use for those people who are working with infertility specialists or who are infertility specialists who are doing ultrasound by themselves. So there are a few things which you should be aware after oocyte retrieval has been done. Oocyte retrieval is a very safe procedure. So the complications are very less and very rare. So you should be aware more about the normal things that you would see after oocyte retrieval rather than think of abnormal. Abnormal findings I will be telling you, but if you just look at the slide here, you can see that the risk of complications is just less than 1%. In fact, even much less than 1%, I would say. So there is nothing to be scared about that part. But the thing is that whenever you are going to see a patient post oocyte retrieval, you should be aware of the normal findings, especially, and the rare complications that you may come across. So when you are doing the scan, you are aware that yes, I should look for these things if they are there. Now, what would be the normal ultrasound findings after oocyte retrieval? Very logical. Two findings you would find. One, that the ovary would be enlarged. Otherwise, also the ovary is enlarged because we are going to stimulate the ovary before we do oocyte retrieval. So, ovary as it is was enlarged even before the oocyte retrieval. However, once we have retrieved the oocytes, a lot of hemorrhage would occur into the follicles during the procedure. So you may find hemorrhagic follicles, lots of them, multiple hemorrhagic follicles within the ovary, and the ovary may look enlarged. This is a normal thing. Now, if I just show you like this and I don't tell you that this is post-oocyte retrieval, you would think these are endometriotic cysts or these are hemorrhagic cysts. But they are just hemorrhages into the follicle. In a way, yes, they are hemorrhagic cysts, and they will be improving after some time. So you don't need to bother about this finding. If you find the ovary enlarged and you find that there are multiple follicles which are showing you a hypoechoic appearance, which is the blood inside these follicles, then you may find some hemorrhagic fluid collection in the pelvic cavity, in the cul-de-sac particularly. It could be mild to moderate, and usually it is less than 200 ml. Now, obviously, on ultrasound, we don't have a very specific way to measure the quantity of fluid that is there or the volume of fluid that is there. But yes, a subjective sensation, you can say that if you just see fluid confined to the pelvic cavity, that is probably fine. It is not a major thing, and even if it is hemorrhagic, it is not an issue. Post oocyte retrieval, even if you find there's a little bit of hemorrhagic fluid or clots in the pelvic cavity, it's still okay. So, two findings that may be considered normal. One is that there is hemorrhagic follicles, and second, there is collection in the pelvic cavity, particularly in the cul-de-sac or in the pouch of Douglas, which may be having some echoes. It may be a hemorrhagic collection, it may be a clear fluid also. So these two findings are normal findings, and you should be aware of these so that you don't get alarmed if you see such a case. Now, what are abnormal findings? These are, again, I am repeating, these are very rare, not very common thing, but yes, you should be aware of them. What can be the abnormal ultrasound findings when we see a patient post oocyte retrieval? The first is that there could be a large amount of hemorrhagic fluid collection. Now, that if we just go back and compare, see, it is very little just surrounding the uterus, maybe a little more in the pelvic peritoneal cavity, but usually it will not go beyond the pelvic peritoneal cavity. If you look at these pictures, you see more of fluid, less of the organs here. So there's a lot of fluid collection, though large amount of fluid collection, moderate to severe, large amount of fluid collection which is hemorrhagic, and you can see there's bowel loops in between. There are some clots also. This is the bowel area, and you can see there's lot of hemorrhagic fluid collection. This amount of collection is not a normal thing. You should be careful, and very often these patients are going to present with abdominal pain, hypotension, shock, and usually within 24 hours of the procedure, which indicates that there is intraperitoneal hemorrhage. Now, what can be the cause of the hemorrhage? Obviously, in the normal condition, the cause may have been a punctured follicle. Most of the cases, it is just the punctured follicle. However, a rare possibility can be that there has been an injury to the ovarian vein. So that has to be very particularly seen, and you should be careful about these patients because this indicates there can be some trauma to some vessel around the area. Then, what else? Then there are minor ones. You don't need to be alarmed about them. Like you may find a hematoma at the puncture site in the abdominal wall if the retrieval was done abdominally. Most of the time, obviously, we are not going to do the retrievals abdominally. We are doing it transvaginally only. But sometimes what happens if the ovary is unapproachable through TVS, it is too much adhered up anterior or something, then we do sometimes take the fluid through the anterior abdominal wall. So in those cases, you may find a subcutaneous hematoma. Some rare cases, you may find a rectus sheath hematoma also. Now, subcutaneous hematoma will obviously be above the rectus muscle, so you will see the rectus muscle very clearly. Rectus sheath hematoma may involve part of the rectus muscle, may not involve, but then there would be some portion of the rectus muscle which will be involved in rectus sheath hematoma. And in this case, you can very well see the rectus muscle is lying below the posterior to the hematoma. So this would be more easily seen with, these would be more easily seen with the linear probe. Now, rectus sheath hematoma can sometimes happen even when we are doing it transvaginally. So you have to be careful about these, because why the rectus sheath hematoma occurs? Due to the rupturing of the inferior epigastric vessels. So these are two other complications that can happen. And again, I am repeatedly saying it is a very safe procedure. Most of the time, you will not come across these complications. Then some further rarer complications is obviously due to the traumatic thing that may happen to the nearby areas or nearby organs. Now, if somebody is totally inexperienced, or if somebody who has not been trained at all in the technique is doing it, then only it is possible. Otherwise, a trained person would usually not make such mistakes. The first thing is, yes, you may perforate the appendix and it may lead to perforated appendicitis. Then the ureter is injured. Always the gynecologists are worried about the ureter. So yes, here also ureteric injury can occur. What can give you the clue to ureteric injury? There may be absent ureteric jets, there may be ascites, and sometimes there may be hydronephrosis also. But hydronephrosis is not all the time. Maybe there, may not be there. Yes, these two findings can tell you. Absent ureteric jets, you have to be very careful when you are evaluating for that. Remember, they can be absent even normally. So be careful, watch for a longer time, and then only you will be able to know. Plus, the patient might give you a history of repeated urinary infections or urinary leakage or incontinence through the vagina, or sometimes even hematuria history may be there. So the history has to be correlated with that. Then iliac artery aneurysm, you will require Doppler for that. Aneurysm, you you will see a dilatation of the vessel, marked cystic area there, and when you put color, it will fill with color. It may show you what you call the yin-yang sign or the Pepsi sign, the red and blue color. This picture is not showing you although, but you can see the neck of the aneurysm here and the blood flow entering and leaving. One color going inside and then coming the other way. Then you may also come across ureterovaginal fistula. How can you look for ureterovaginal fistula on ultrasound? Difficult job, but with Doppler you may try. First of all, to see ureterovaginal fistula, obviously you have to be suspecting it. So if the patient, what kind of a history patient might give you? Patient might be giving you history of urine coming out through the vagina. So that can be your clue, and then repeated UTIs may be occurring in that patient. So in such a case, what you can do is you can focus the probe on the vaginal area, keep the bladder a little full, deep, and you should have you should do a transvaginal scan. Now, if you see here, the ureter runs next to the vaginal canal, and this is the reason why the ureterovaginal fistula can form. See here, this is the bladder and this is the vaginal wall, and in between the two is the ureter. So it's quite possible that you can injure the ureter, and although ureters are more commonly injured in hysterectomy patients. Now what you have to do is, yes, just focus here and put Doppler, and you would see that the urine flow is going towards the vaginal area. See, can you see this blue color? It's a little subtle thing, so you will have to keep the velocity range low, not very high, and observe for a certain period. Now we cannot see the ureter if it is normal, but if the urine is flowing from the ureter to the vagina, you may be able to detect that flow of urine by Doppler. You can see a blue colored flow is coming from the ureter here towards the vagina, and if you keep the velocity ranges a little lower, you will be able to capture it, but it is not 100%. For that you may need further contrast studies and all for diagnosing the fistula. It is not necessarily that you would be able to diagnose it by ultrasound. Fine. So that's it, what you have to know about the post oocyte retrieval ultrasonography. The main thing is that you should remember that the normal findings are this. This is the normal findings, and for even if you forget about abnormal, because those are rare, but remember these are normal findings, and you should not misinterpret them as abnormal. What are the normal findings? Hemorrhagic follicles with enlarged ovary and a little amount of hemorrhagic fluid collection, which may range from mild to moderate. Some cases, mostly it is mild. In some cases, it may go to moderate, and you may see it surrounding the uterus. Some blood clots may also be there. That is all you may see in the pouch of Douglas. So these 2 points you need to keep in mind whenever you are seeing a patient with post-oocyte retrieval, where the oocyte retrieval has been done in the patient and you are examining the patient just after that. So that's all. Thank you.